My name is Dr. Doolittle. I work at Carpathia Collaborative in Dallas, Texas. I just wanted to share with you a little bit about what I do with my chiropractic technique that helps with drainage of sinuses specifically. Okay, so I'm just going to show you on this anatomical picture. Right here we have the sinus cavity. This is the maxillary sinuses right in here. That's visualized in this area. Right up this region, we have the Eustachian tube. What happens with this is sometimes mucus can get built up just whenever we have all that inflammation and pressure in the sinuses from allergies, from mold, toxicity, from any of those other things that can create sinus pressure, bacteria in the sinuses or anything like that. Then what happens is the Eustachian tube itself starts to get a kind of like a pressure reduction where it's not able to release the pressure like it needs to out of the ear, and that can also retain some of that bacteria, the mold, spores, and other things in that region. So what I'll do is I'll do an adjustment to these three tiny little ear bones with a little slight tug on this lymphatic, or it's like a little ligament right here, and whenever I tug on that, it helps to reset these three little bones into the right place, and also can help to facilitate the drainage of the mucus out of that Eustachian tube. This is also very important because these three little bones are supposed to be moving every single time that you're hearing something. Every sound wave that's going in, it's moving this tympanic membrane. That tympanic membrane itself is supposed to be moving those three little ear bones, and that's sending an activation signal into that vestibular cochlear nerve. So we want to make sure that that's able to get all of the information that it needs so that it can send that properly over to the temporal region, which is right in here. The temporal region is important for like focusing on, it's kind of like conversion of short-term to long-term memory. It plays a part with the PTO processing is what we call it, and some of those things also with timing and like metronome beats and your ability to like know dates, times, and keep proper amounts of your times, like so you're on time whenever you go places and things like that. A couple of other things, but those are just some of the more notable things to mention. And then we focus on adjusting in this region around on the cranial bone. So right in here we have the sinuses right behind here, that's the maxillary sinuses, and then right behind here is the frontal sinuses. See all those tiny little bones that need to be moving appropriately. So these cranial bones, we all think about babies whenever their soft spot grows in, that the sutures kind of close, and we all think that maybe they don't move as much, but they actually do, and they're supposed to be moving at least like 1/4 of a millimeter to 1/2 millimeter with every single breath. We want to make sure that those are moving appropriately too, to get the proper sinus drainage, because we have a sphenoid bone that rocks with each one of those breaths, and that's the bone that goes right between those sinuses. It also has cranial nerves that go through the tiny little holes in the actual cranial bone. It's like called foramen, and those cranial nerves themselves take care of many different functions. We want them to be able to do their functions, perform their functions appropriately, and we want that sphenoid bone to be moving like it needs to help with some of that drainage. Here you can see the laterals aspect of the bones. See how each one of these suture lines, we want to make sure that those are moving appropriately, and see how this little sphenoid bone right there, that yellow one, that's the one that I'm talking about that's very important. It sets as kind of like a bridge right between those sinuses. So we need to make sure that those are moving well. And then I'll talk to you a little bit about the temperomandibular joint. So this is actually your jaw right here. This is like the lower part of your mandible or your jawbone that comes in and inserts right into here. Many of us have TMJ issues or tightness grinding our teeth. You know, if we ever have any dental problems and we chew on one side more than other, then our jaws can get out of alignment. We never think about how important that is to keep those in alignment, but the muscles and the little ligaments, there can be so much tension that gets built up in there, and whenever those are not moving well, then it can help with kind of facilitating pulling those cranial bones out of place, making that sphenoid bone where it's not able to move appropriately, and we also are not going to be able to have the clearing of our sinuses like we need to with all that tension in these muscles, the pterygoid muscles inside, you know, the masseter muscles on the outside, temporalis muscles, things like that. So basically I make sure that all of those different bones are moving like they need to. Those are kind of some of the more intrinsic bones that we don't think about that chiropractic can help with. But here at Carpathia, we are all about functional, and we're all about helping you with your entire body and every single function that should be working. We want to turn it back on. So my name is Dr. Doolittle. I'm the chiropractor here at Carpathia Collaborative. So excited about the work that I do and all the good that it's been doing for people, and I'd love to see you as well.